Dr. Constant, let's talk about nutrition in children. And let's talk about eating habits. In terms of like infants, what is the best way to get children to start eating solid foods?
Well, we usually introduce solid foods, meaning anything that is not milk, between ages of 4 and 6 months, and that's in the puree form. And then after 6 months is when we slowly start to introduce other types of solids and increase the consistency. It's important to transition from puree to an increased consistency until fully solid by 12 months of age, because if you delay that transition, a lot of times children will develop what's called an oral aversion, meaning they have an aversion to certain textures. They're not used to those textures in their mouth, and they don't want to try new things because it bothers them, or they're afraid, or they're just not used to using their gag reflex. So it is very important to transition children from puree to solid foods by 12 months of age.
And so there is a couple of school of thoughts, if you will, about how to get kids or infants, babies used to eating solid foods. There's one where, the traditional one, which I exercised when I had my three children, which is you feed the child with a spoon, right? And sometimes they
Right.
don't accept it, they reject it, but you try again until they get used to it. So it's almost like developing a habit. And then there's that other school of thought of, you give the child as young as he may be the spoon, or you let him play with the food, use his fingers to kind of get familiarized with the texture, with the taste, and you kind of let him go, or her, at her or his own pace. How does that work out? And can you shed light on that?
Sure, those are two different theories, and honestly, you can't go wrong with either one. In my office, I usually encourage parents to do what works best for them and their family. And I think once it's comfortable for you and your family and it works, then you'll be fine. But you can't go wrong with either way. And it just depends on how your child really identifies with food. Some children, even in infancy, just don't like to be messy. They don't like to grab food and play with it, and others don't mind at all. So it really is just up to you, but you can't go wrong either way. And as long as you're introducing foods and you're allowing them to explore, I think that then you're always going to be on the right track.
What are the most common eating disorders in children?
Well, eating disorders per se are not common in children. What I will say is that we see a lot of disordered eating. And what that means is there's a lot of picky eating. Like I mentioned before, oral aversion, meaning just an adversity to certain textures. There are behavioral issues around eating just because eating has changed in our society. We rarely sit down together to eat for every single meal. We rarely have like a designated time to eat, where nowadays even young toddlers eat on the go, eat in their stroller, or maybe in the car. And so there are some disordered patterns that are usually associated with eating, but not necessarily an eating disorder per se, which we usually would see maybe in older childhood or adolescence.
So, what do you recommend? It sounds like for creating those healthy eating habits, it sounds like having an organized meal plan or certain times of the day that you can create consistency or good habits. What would you advise?
Well, I would advise absolutely that is setting designated eating times. Oftentimes eating ends up being on this spectrum of time where you start in the house and you keep on eating as you're walking out the door and in the car. And I think that it's important to have a designated time where you start and you finish. And even if you don't finish your food, that's fine, but the eating time should end. And I also think it's important to remove stress around eating. I think oftentimes we're very preoccupied with making sure our children eat the quote unquote right foods or get all of the right groups. While that's ideal, we just can't have it that way all the time. So as parents, we need to learn to relax a little bit when it comes to mealtime and just allow our children to enjoy what they're eating and enjoy the time that they have with us, that they're sharing with us, and not focus so much on how much they're eating and if they're eating the things that we feel are important at that time.
I want to go back to the infants. By what month should they be having breakfast, lunch, and dinner? In addition to, of course, the milk feedings.
Right. So usually when you start, and depending if you start introducing solids at 4 months versus 6 months, you would start with one meal a day, and then you kind of just go by what your infant is doing. Sometimes they're enthusiastic eaters and they're ready to go up to 2 or even 3 meals a day, and some are a little bit slower and it takes them longer to get there. But ultimately, I would say between 9 and 12 months, you should be able to give your child 3 meals a day.
And what can parents do to deal with a picky eater at home?
A picky eater at home is a very difficult situation for everyone. And I think that all of us have had at least one child who's a picky eater. And the advice that I give is very simply, number one, try to hide the foods, cut them up, mix them into something else so that your child doesn't see it or taste it. You can find 2 or 3 things that your child may like and stick to it. There's nothing wrong with them eating the same thing for a few days or even months at a time. Over time, as maturity comes, their palate will change and you will be able to introduce other foods. And lastly, most importantly, is just don't be so hard on them. Don't make food a battleground and don't put so much importance on eating something, because that's just going to push your child further away from trying something new.